7 news time is 5:54. Now that we're finally getting a break in the weather, you and your kids might want to get outside, but with more activity comes more risk for injuries, especially ankle sprains, which are no fun. So Dr. Eric Johnson is here to talk a little bit more about treatment and prevention. Thanks so much for waking up with us.
Yeah, thanks for having me. So what I'm going to be talking about is sprained ankles, and it's one of the more common injuries that people have.
Yeah.
Whether it's the athlete, weekend warrior, or just someone doing yard work. And actually, if you sprain your ankle, there's actually an 80% chance that you sprain your ankle again.
Oh,
so
wow.
That's kind of why I'm here, is to prevent those ankle sprains.
Absolutely. So you have some good treatment measures for us that we can do in case we would sprain our ankle.
Yeah, so kind of like first thing I would do is kind of like make sure everything's in alignment. And then I would work on kind of the soft tissue therapies, which I focus on loosening up muscles and working out ligaments. And the system I use is what's called FACTOR, which is functional and kinetic treatment with rehab.
Okay.
And what I use is actually a surgical steel beveled tool.
Okay.
And what I'll have you do is
do a little demonstration here.
And it's just a progression as far as like muscle loading and kind of working with the soft tissue.
Okay.
And whether it's if it's a really bad sprained ankle, I just statically just do like non-weight bearing, just kind of like this, work out the muscle, and then eventually kind of the more advanced stuff and more dynamic stuff is actually have people load the muscle onto a Bosu ball like this. So I'll actually have you stand there.
Oh, okay.
Yep. And then,
I've never done this in a dress before.
Yeah, and then actually have you do a squat. And
Okay.
actually, while those patients are doing that, I'll be working out the ligaments and then also like the muscles that are usually affected by the sprained ankle as well.
Very good. We have just about 30 seconds left, so I do want to get to, are there any ways that we can prevent this from happening?
Yeah, and so it's a lot about exercise and stretches. A very common stretch that people do is like the ABCs. A big one is utilizing a Bosu ball to, focus on balance. And then also, one thing we didn't get to is glute activation.
Oh, yes.
Which is a huge thing. And just
take some pressure off of the ankles.
Yep, and just activating that glute and make sure everything's fired correctly. So
wonderful. Dr. Eric Johnson, thanks for being with us, and we'll have all this info for you up on WKOW.com. All right, for now, let's go ahead and check in with meteorologist Brandon Bohr.